Welcome to the 2012 Rally for Midwifery Care. We're rallying here in February this year, even though it's a little bit rainier and colder, because on International Midwives Day, when we usually have a rally, the legislators won't be here and we won't get this chance to express our views to them so directly. My name is Silke Akerson, and I am a mother and a midwife in Portland, and I'm also the president of the Oregon Midwifery Council, which promotes maternal and infant health in Oregon by increasing access to midwifery care and providing public education about birthing options. I was born at home here in Oregon in 1978 at a time when midwives were just beginning to reestablish themselves. And a lot has changed since then in birth culture and in midwifery regulations since then. A lot has remained the same. Midwives are still focused on good, safe, family-centered care. And I think that we're now on the verge of a new era of midwifery care as an option for all women, not just those women who are part of subcultures or communities that have traditionally used midwives, and also not just for women who are part of a small, educated group that have access both informationally and financially to midwifery care. So I'm really glad to see all of you here. This morning I was thinking about my motivations and my reasons for coming to this rally and to this lobby day, and I identified two motivations that are the most important for me, and I'm imagining and hoping that many of you share these same reasons for coming. So my first reason for coming is to celebrate the high-quality, family-centered, safe, and cost-effective midwifery care that is available in our state. And my second reason for coming is to press our legislators and our insurers to increase access to this excellent care for all Oregon mothers, whether they choose to birth at home, in a birth center, or in the hospital. I think it's time that we start thinking about midwifery as a whole, not just home birth midwifery, birth center midwifery, hospital midwifery. And we know that all women should have access to midwifery care. And I was thinking, well, but why should all women have access to midwifery care? What do we know about midwifery care? And these are the things that I was able to reflect on that I know. We know that midwives in all settings provide personalized, effective, and satisfying woman-centered and family-centered care. We know that midwives value women's autonomy and that midwives work in partnership with women and families, and that they use health education and informed choice to return decision-making power to its rightful place with birthing women and families. We know that midwives can provide safe care in home, birth center, and hospital settings, and that our outcomes are consistently as good or better when matched with similar groups of women being cared for by other provider types. And this is particularly important at a time when the maternal mortality rate in the U.S. is 50th in the world. And the neonatal mortality rate is 34th in the world, even though we're one of the countries that spends the most on healthcare. We're actually the country that spends the most on healthcare in the entire world. And yet we have, and almost all of the babies in our country are born in hospital, and yet we have these high rates of infant mortality, neonatal mortality, and maternal mortality. And we know that around the world and in the U.S., midwives can be part of the solution to these high rates. And speaking of statistics, I just wanted to stop for a moment and say we're really excited that finally in the next couple of years we're going to be seeing accurate data about midwife-attended births, and actually births by all provider types in Oregon, as a result of the work we did last year with the Oregon Health Sciences University and the Oregon Medical Association and Representative Greenlick and Senator Bates in passing HB 2380, which will finally give us accurate data from the birth certificates for all provider types. And we're really excited to finally have Oregon-specific data so that we can all clearly say this is what midwife outcomes are in Oregon. So on to the things we know about midwifery care. We know that women who are cared for by midwives experience fewer interventions and have a much lower cesarean section rate, even when matched for risk levels. So it's not just because our clients are generally lower risk. The CPM 2000 study found that women cared for by CPMs had a cesarean section rate of 3.7%. And there was a survey of hospital-based CNM practices, and the cesarean section rate was found to be 12%. And just keep in mind, this is at a time when the national cesarean section rate is about 30%. So, and that high cesarean section rate is taking a toll on us as a country, both financially and heartbreakingly in increased deaths and complications for mothers and babies. Financially, the cesarean section rate, the cesareans alone cost our country $14.6 billion in 2004. So we know that midwives can be a major solution around that. We know that midwifery care is a cost-effective option that can save the state of Oregon money while moving us closer to public health goals like increased early prenatal care, reduced cesarean section, and reduced induction before 39 weeks. Out-of-hospital birth with a midwife costs less than half that of a hospital birth. And we know that even the small number of home birth midwives in Washington state, attending about 1% of births in that state, saved Washington state $2.7 million in just 2 years. So we know that that could be something that we could pursue further in our state. We also know that out-of-hospital birth with midwives is on the rise. There was a National Center for Health Statistics brief in January that showed that from 2004 to 2009, out-of-hospital births increased by 29%. And that looks really different across different parts of the country. In Oregon, that means that our out-of-hospital birth rate is now at 2%, and it's the only state that has a higher rate in the country is Montana at 2.6%. We also know that Oregon has been a pioneer in midwifery and out-of-hospital births since the 1970s, and that it's been at the forefront of creating laws and systems that work for mothers and babies and respect the autonomous practice of midwifery. So what do we do to bring these benefits of midwifery care and the option of out-of-hospital birth to all the women and families of Oregon? I have a few ideas, and I'm sure that each of you have many more. First and foremost, we can remind our legislators that birth is a normal event, and yes, it does include risk, but this normal event with its inherent risk belongs to women and families, and they must have the right to choose where and with whom they give birth. No law should be created that limits this freedom for Oregon families. And, you know, we're in the process of working on a potential mandatory licensure law for midwives, and we need to make sure that if that law comes into effect, that this protection for families is included, that it's understood that the law is about regulation of midwives, not about restriction of families' choices. We can ask our legislators to only consider legislation that recognizes an independent, direct entry midwifery whose rulemaking and regulation are overseen by experts in midwifery care, not by state administrators. We can ask our legislators to move forward with legislation that recognizes midwives as a public health solution for the mothers, babies, and families of Oregon. We can point out that midwives' preventative care can help reduce our high infant and maternal mortality rates in the U.S. So I'm not just talking about out-of-hospital birth, I'm talking about all midwives and midwives as the standard of care across all locations of birth. We can emphasize that we want legislative decisions that are informed by accurate information about midwives and midwifery. And we can let our legislators know that we reject the climate of fear, rumor, and hearsay that sometimes surrounds discussions of midwifery and out-of-hospital birth. So we want decisions that are based on accurate data and decisions that are based on the actual outcomes that we have. We can ask our governor and our legislators to require the Oregon Health Plan to cover midwifery care with an LDM from the beginning of pregnancy, finally putting an end to the restriction of choice in care and place of birth for low-income women in Oregon. We can demand that our private insurance companies reimburse licensed direct entry midwives attending home and birth center births. We can press hospitals to change policies and internal cultures that restrict choices for birthing families and that limit nurse midwives' ability to provide individualized, expectant care. And we can partner with community organizations and public health organizations to bring information about birth options, about midwifery care, and about midwifery training to communities that haven't had access to midwives in the recent past. And then lastly, we as midwives can continue to take responsibility for creating systems of accountability and of quality assurance to ensure that midwifery is always the gold standard of care and that we're always improving our outcomes and improving the care that we give. So that was a long list of things we can do. Even so, I feel confident that together we can bring midwifery care to more and more women and families. I'm so glad to be here with all of you today, asking for greater access to midwifery care in Oregon. I hope that after the rally you will come up and talk to me and share with me your vision of how we can move midwifery forward to ensure that the midwives' model of care is the standard of care for pregnant and birthing women in Oregon.